Hello and welcome to the podcast Eat Better Food Today. I'm your host Ken Cunningham, and I'm excited to be sharing insights on why we believe that health and longevity begins with the food we eat. The goal of this podcast will be to inspire, educate, and enable folks to live a healthier life and do it affordably. My wife and I have been on this journey for over 10 years, and we continue to work on it every single day. Percent of the profits from this podcast will be put towards child hunger, with an initial focus on the poor suburb in America, East Cleveland, Ohio, which, by the way, we just got approval to start fundraising for on Monday, so pretty excited about that. As a reminder, please subscribe to this podcast. Be sure to visit my website, Eat Better Food Today, for links to the show, videos, recipes, books, and articles our guests provide. On this episode, we're grateful to have Dr. Leben Tefera. Dr. Tefera is a staff physician in the vascular medicine section of the Thomas Family Department of Cardiovascular Medicine at the Cleveland Clinic. Dr. Tefera is experienced in the medical management of patients with all forms of vascular diseases to help them reduce their risk of blood vessel blockages. I need to slow down. Dr. Tefera earned his doctorate of medicine from the University of Pittsburgh School of Medicine, completed his internal medicine at University Hospital's Cleveland Medical Center. He received his specialty training as a fellow with vascular medicine at Massachusetts General Hospital in Boston, an affiliate of Harvard Medical School. Dr. Tefera and I met in the ICU at the Cleveland Clinic in October of 2022. He was part of the team that brought me back to health and is currently my vascular medicine doctor. In this episode, we'll explore Dr. Tefera's thoughts on food, health, and longevity and discuss what continues to inspire him. Welcome, Dr. Tefera.
Thank you. Thank you for that great introduction.
Sure. Yeah, my son is at Boston Medical Center. He has a pretty interesting opinion of Mass General, so
yeah,
we'll get into that.
Rivals in the same city.
Exactly. So the first question I usually ask is around, and I got a good answer to the podcast I did earlier today, but a question about what you had for breakfast this morning, because I believe a healthy breakfast is good start to a good day. So just curious what you had
breakfast
for
is a great start of the day. So I typically work out in the morning, so I'm not a very ravenous person in the mornings. So it's typically either 2 scrambled eggs and cottage cheese, or this morning just a protein shake on the go.
Okay, so you do that before or after the workout?
After the workout.
Okay,
yeah.
I do this. I have a shake after the workout as well. So.
Yeah, I typically do a fasted workout, and then after that have a protein shake, or if I have more time at home that morning, depending on when my clinic starts, I'll have 2 scrambled eggs and cottage cheese and a protein shake. So try to get in as much protein as I can in the morning.
Nice. That's very good. Yeah, I usually put whey protein powder in my shake to
Absolutely.
Get the protein.
Yeah. It's an easy way of getting a high amount of protein with a low amount of calories.
Yeah, and I'm too lazy to cook in the morning. I always cook dinner, but not breakfast, not so much. So, I know the Cleveland Clinic, I just saw this ranking, is the #1 heart hospital in the U.S., which as a patient I'm very happy about. Can you kind of explain in layman's terms what you do at the Cleveland Clinic as part of the vascular medicine section?
Absolutely. So I'm a vascular medicine physician with an expertise in treating patients that develop blood clots, and so I'm the director of our PE clinic. So a vast majority of the patients I see are patients that have developed blood clots either of the legs or of the legs that have traveled up to the lungs. And so I consider myself a PE doctor or a pulmonary embolism doctor.
Nice. And what have you kind of learned in your journey? Because you've kind of been to Pittsburgh, to Cleveland, to Boston, and now you're kind of situated here. And I also noticed you had a degree from the Weatherhead School at Case. So what?
Yeah, I think the big takeaway of what I've learned in relation to pulmonary embolism has been as much about awareness. It's the 3rd leading cause of cardiovascular death. So you have heart attacks and you have strokes, and then PEs or pulmonary embolisms are 2nd or 3rd. And yet everyone knows about heart attacks.
Yes, they do.
Everyone knows about strokes. Everyone can tell you the signs and symptoms of a stroke or a heart attack.
Yeah.
But if you were to go out and ask people about pulmonary embolism, 70% of the U.S. public has never heard of pulmonary embolisms. 80% don't know the symptoms. And yet it's the 3rd leading cause of cardiovascular death. And so I think I've learned that there's a lot we can do as physicians, as advocates for PE, to educate patients, and I think that's where a lot of it starts.
Yeah, I agree. I mean, I didn't, until I had my condition, I did not know any of that.
Absolutely.
And didn't know a whole lot about it until I had my visit. So, and if you always want to be a doctor, is that something you want to be since you were a kid, or what?
So I'm Ethiopian, so I'm first generation Ethiopian, and so it was one of those things kind of inbred into you that you will be a doctor. And so my journey was a little unconventional in the fact that I started off with a biomedical engineering degree, thinking that I was going to be a biomedical engineer, but it seemed a little impersonal to me whenever I started getting into it, and I wanted something more personal, a one-on-one connection with people, and that's what drove me into medicine.
Nice. Yeah, and I would just say online for the Cleveland Clinic, you get outstanding reviews. I mean, so that's you're doing a very good job.
Thank you. I try my best.
So what, I guess, describe when you talk about a pulmonary embolism or unprovoked blood clots, which is also what I had. What is that? Why does it happen, I guess?
Yeah. So typically when we talk about blood clots, the big categorization is blood clots that are spontaneous, meaning a patient was running a marathon the previous day, out of the blue, completely healthy, and develops a blood clot. So we call an unprovoked blood clot. Or we have patients develop what we call provoked blood clot, meaning it was situational or in some certain setting. And so most common setting would be the setting of immobilization. So if a patient had prolonged travel, a patient recovering from surgery, a patient that was in the hospital, those are the most common things we think about when we talk about provoked blood clots. So whether that be a blood clot of the legs or the lungs, or we think of other provoking factors such as cancer. So cancer, 1 in 5 patients with cancer will at some point in time develop a blood clot. And so that's another thing that we think about in terms of provoked or situational blood clots.
Oh, interesting. Okay. So it's kind of the sedentary, and then on the one when you say to run a marathon or something, is that is serious? Are they both serious, I guess, or is that?
Yeah, absolutely. They can both be as serious. Okay. So you can have patients that have what we call the provoked blood clot, the first type of blood clot, that's just as high risk as a patient who has an unprovoked blood clot.
Okay.
And it's really just the luck of the draw. You never know which blood clot it's going to be if you're prone to development of blood clots, and so that's what can make treatment of blood clots a little bit tricky.
Interesting. So when I visited you for my 1-year checkup, 2 years is coming up here, we had a long discussion, kind of what happened to me, how I was lucky to be alerted. My Apple Watch alerted me to go to the hospital. My son, the doctor, and my wife made sure that I got there. I guess, what can people be doing to make sure they survive this illness? I mean, because the discussion we had is a lot of people, if I didn't have an alert, I could have gone to bed and never woken up the next morning, which I know happens. I have, unfortunately, friends that have had that happen. So what can people be doing to prevent this?
It's a great question. I think the number one thing is awareness, right? So knowing the symptoms of a blood clot. And so symptoms of a blood clot when we talk about the legs would be swelling in one leg, or leg pain or cramping type of pain in one leg or a calf, but not the other. Very odd to have 2 blood clots simultaneously at the same time. So we typically say one leg but not the other leg being affected. For blood clots of the lungs, that would be chest pain or shortness of breath. Those are the most common symptoms.
Okay.
And so I always tell patients, if you're experiencing something that you think is urgent or is a sudden change, then always to get it worked up, whether that be by reaching out to the primary care doctor or going to the emergency room.
Yeah, and I will say, speaking from experience, men do not like, if they have a pain, they just figure, well, I'll just work it out, I'll stretch it out, it'll go away. But that's not, in this situation, not a good solution to the problem.
Absolutely.
So
and
how do we get men,
Yeah.
the male figure, to kind of want to take care of themselves better.
Very, very, very common that I see this particularly in men. You know, what I always tell people is it's better to waste 8 hours in the emergency room than to waste the rest of your life.
Yeah.
I have patients that ignore the signs and symptoms of blood clot for a day, 2 days, 3 days, 4 days, and on the day 4, they present in cardiac arrest. Typically, whenever we see our sickest patients coming into the hospital, it wasn't their symptoms started immediately. They've had a slow, gradual increase in their symptoms over a week, over 4 days, 5 days. And so whenever something feels wrong, and it's acutely, meaning suddenly wrong, it's worthy of evaluation.
Yeah. Very good advice.
Yeah.
So I understand you train for marathons and you play the piano, which is kind of too interesting. So what food choices do you make to stay healthy, other than the healthy shake or scrambled eggs in the morning?
You know, for me, it's about intaking a good amount of protein. My goal has always been to build muscle, and so you can't build muscle if you're not getting in enough protein. And so my diet focuses mainly around protein. It's good satiation when you're eating amount of protein as well, so that prevents you from eating things that are unhealthy. So it's not taking in those unhealthy carbs, which I'm prone to. My big weakness is potato chips. I love a good kettle chip. So, the more protein that you add with a lunch, or the more protein that you add with your dinner, whatever it may be, a lean meat typically is what I like to consume. So chicken is my go-to, chicken and salmon. Okay. My wife and I love, and so those are kind of my go-to. And so trying to incorporate that in every meal, breakfast, lunch, dinner, is my big nutritional intake, I'd say.
Nice. And salmon, any other kinds of fish? I just interviewed the Monterey Bay Aquarium, so they're talking about all different kinds of seafood. So.
Yeah, I think, salmon and shrimp are the two that we typically eat. We've tried cod in the past, but our go-to has always been salmon.
Yeah, our go-to is typically salmon or shrimp.
Yeah, and our plug is Costco. Costco sells salmon at a very good price, and so that's kind of our go-to spot for getting a good week's worth of salmon.
Nice. So food and exercise. So I don't know how. Me personally, if I wasn't healthy, I think I would have had a different outcome than what we experienced. And then also in the rehabilitation. I mean, how do you talk to patients about food and exercise kind of post, I guess, the symptoms?
Whenever you talk about food, it's very difficult to tie those links to blood clots directly. But if you think about it, there are indirect ties with food and blood clots. So the number one mediator when patients talk about blood clots, or we talk about blood clots to patients, is inflammation. And there's more and more emerging research showing that pro-inflammatory foods can have an inflammatory effect on your body. So when we talk about refined foods, refined sugars, refined artificial flavorings, these are things that are pro-inflammatory. So that can cause inflammation throughout the body, and that inflammation in turn can cause blood clots. And so when it comes to diet, that's probably the closest tie. The other tie that's well known, it increases your risk of a blood clot by 30%, would be obesity. So patients that are obese with a BMI, is how we measure it, so body mass index, are more prone to development of blood clots. And so we know that obesity is another thing that can in turn cause blood clots. And as we know, obesity can be triggered by the foods that you eat.
Right. Absolutely.
In terms of exercise, being healthy absolutely can help you survive a blood clot. When we think about what a blood clot does and how it can kill people or hurt people, it's a blood clot that starts in your legs typically, travels up your legs into your lungs and stops your lungs. That in turn puts extra pressure on your heart. And if you have a very healthy heart, you're able to take more stress on your heart than someone who has an unhealthy heart. So you being very healthy and active and working out certainly played in your benefit in substantially increasing your risk of surviving that blood clot.
Yes, it did.
Yes.
So what are your expectations for lifestyle with patients that have had a pulmonary embolism? I mean, we've talked just about, like, you like to travel, we like to travel. Yeah. So it's not, that long trip that I took kind of, led to what happened. But you also say, at least when we've talked, you kind of encourage people to just go back out and keep doing things. You don't have to restrict what you're doing post.
And I think that's one of the biggest mistakes I see in patients whenever they're coming from different providers and we're talking about blood clots. The old school thinking used to be, once you've had a blood clot, whether it be of your legs or your lungs, you need to go home and take a bed rest for 3 or 4 days, not realizing that's typically what gave patients the blood clot in the first place. And so I encourage patients to not push themselves drastically. Don't have a blood clot and go out and do vigorous exercise the next day, but to at least try to get back into your routine of life. It's really important. The number one reason patients develop long-term shortness of breath after a blood clot has nothing to do with the blood clot. It's deconditioning. They're simply out of shape. And a lot of that has to do with they go home, I can't exercise for the next 3 months. I can't exercise for the next 6 months. And that change makes you deconditioned. You just get out of shape.
Yeah.
And then a lot of people attribute it to the blood clot. They get this $1 million workup. Everything comes back normal. They're just out of shape. And so that's probably the number one thing I tell patients is, don't go out and run a marathon the next day, but try your best to get back and listen to your body. There's no guideline recommended exercise regimens you can do after a blood clot, but there's nothing you can't do either. And so, I always try to tell patients, get back to what you are doing. Don't rush it. Listen to your body. If you feel like you're pushing it too hard, then obviously, or discuss it with your doctor.
So, I mean, we've talked about it on the show in the past. I mean, even like trying to encourage people just to, after you eat dinner, do a 10-minute walk, 20-minute walk, or just kind of build up to, getting out, at least walking, a half hour a day is going to be healthy. It's going to help you digest your food. It's going to help you absorb your food, and it's physically going to kind of help you along the way.
Absolutely. 20 to 30 minutes daily of steady state cardio is more than enough. If we can get people just to do that small thing, we're steps ahead of the gap here.
Yeah, outstanding. So what are your thoughts on food as medicine? That seems to be a big thing these days. Talked about, Tufts has an institute now, Food as Medicine Institute. So what are your thoughts on that and health, staying healthy?
Yeah, I think it's an evolving research. I think there is evolving research showing it. And I think in a couple of years, we'll probably have more ideas about that link right now. But I do think it's something that's probably understudied and underutilized. People always talk about, when I fly to Europe, I can eat whatever I want and I feel better. And I feel really good, and then I come back to America and I eat 3 or 4 things and I feel ill, or I don't feel as well, and I feel bloated. I can attest to that. What is it? Is it the refined sugars or the things or additives that are in our foods that are maybe not allowed in the EU? I think that's an ongoing thing of research. And what are the long-term side effects of those? The additives are coming out much faster than we have time to do studies on the additives and the long-term effects. And so, unfortunately, when we find things out about what's in our food, it's retrospectively. It's having a bad outcome, us going back and investigating, finding something that's been in our food, in our water, an environmental risk factor that's affected thousands, millions of people already. And so it's an ongoing thing. I'm just happy to see people paying more attention to it.
Yeah, I am very happy to see more people paying attention to it. Yeah, there was a study, 11,000 new food products were brought out last year, and of those 11,000, the majority were ultra-processed foods.
Yeah.
So, and it's something we talk about a lot is just keep it simple. When you're having salmon, you don't need to put a lot of stuff on it. I mean, olive oil, salt, pepper, it tastes great. You don't need to go crazy.
Let the food do the flavoring itself.
Exactly.
Yeah, absolutely.
Exactly.
And when you have 11,000 new additives coming out a year, it's impossible to study 11,000 new additives and know every single side effect and how it's going to affect every single person. And so that's why these studies are evolving. I'm just happy to see that they're ongoing.
Yeah, couldn't agree more. So what are your thoughts on encouraging more people to eat healthy meals at home? I mean, that's part of what we talk about on the show as well. But
I think when we talk about healthy diets, it's important to see why people can't eat healthy. I see lots and lots of patients every day, and I always ask them, or sometimes I try my best to ask them, what are you intaking within your diet and how that can affect your lifestyle? And the number one thing I hear is that it's expensive. It's not cheap to eat whole foods, right? Sometimes if you go to Whole Foods or you go to a grocery store, sometimes buying those foods that are whole, consider whole foods or pure ingredients, are actually more expensive than buying the refined foods. Those are typically easier to make, easy to grow. And so the number one barrier I see, unfortunately, is 1, cost, and then 2, access. Not everyone has a local grocer or a local farmer's market where they can go and buy these foods. And so I think eliminating those things, part of what you're trying to do with your charities here, I think that's a huge goal. We have to really tackle access to food.
Yeah, I agree. There's we were in Chicago this past weekend, and I guess two learnings from that. One, we ate out for 4 days.
Yeah.
Came home, we had gained weight. Ate at home for a couple of days, and the weight's gone because we ate at home. The food was good, but you're still eating out. And then 2, we met with a gentleman up there who's kind of started something a little different than we want to do in East Cleveland, but he is providing fresh fruits and vegetables to disadvantaged neighborhoods in Chicago. And he's set up a nonprofit to basically, because of the access issue, they just don't have access to that. So,
I think it's a huge issue. You talk about food deserts, lack of areas that have a lack of a local grocer. And so a lot of people are going to local convenience markets where they're able to buy their food, but most convenience markets aren't going to have fresh fruit, fresh meats, and so it's a big issue. Yeah, I agree 100%. So can you share a few stories of how your approach to medicine, vascular medicine, has helped your patients at the Cleveland Clinic? I think taking each patient you see as its own specific patient. I think one of the things that was nice about having that biomedical engineering degree wasn't waste of time. I always thought it was going to be waste of time, but it wasn't really until I got into clinical practice that I realized it wasn't. whenever you're doing biomedical engineering, most of your tests, most of your exams are not multiple choice tests. Most of your tests in medical school are almost all multiple choice tests. And you realize when you're seeing patients, seeing a patient is not a multiple choice test. Each patient is highly different.
Yeah.
And so having a patient-centered approach, I think, has been very, very useful. Talking to patients about different medications they can take after a blood clot, it's kind of a useless thing to talk about to the patient if they can't afford it.
Right.
And so talking to patient and approaching each patient specifically has made a big difference.
Yeah, it makes a big difference for them and obviously for their outcome. I think.
Absolutely.
Yeah, I think asking the right questions to understand your patients is important. Yeah.
And I think the other thing that we sometimes don't do in medicine or don't do as well is making sure patients comprehend what happened to them. A lot of the time we come in, it's a quick office visit, we give the lecture that we're typically used to giving, we say, do you understand? And then we walk out, and that's kind of the end of the visit, and the patient may not have completely comprehended what happened. And patients are more likely to follow up on recommendations when they understand what's going on with their body. They're more prone to follow advice. And so, one thing that I typically do is I'll talk to the patient, ask if they have questions, leave the room, come back when I walk them out, and I said, do you have any more questions? And there's typically 3 or 4 questions that pop up at that time, but I think those 3 or 4 extra questions are typically a reflection of what they actually want to know, and maybe my fault of what I did not explain well. And it's always an opportunity to kind of go back and clean things up and make patients more likely to follow the recommendations.
Yeah, one of the things, I'm a very visual person, so what I liked when we had our follow-up visit shortly after the incident, you basically brought up on the screen and showed I couldn't comprehend what blood clots in my lungs looked like, but when you showed me the visual on the screen of kind of what was going on, it's like, now I get it.
Yeah, and I do try to do that. I try to show patients what's going on within their body, because sometimes when we say blood clots, patients think, how big could it be? 1 centimeter, 2 centimeters, and no, it's a substantial blood clot. Something that lands you in the ICU is not going to be something that small. And so when patients comprehend just how close they were, how big their heart grew, that it was not supposed to be that big, they finally kind of comprehend, oh, wow, I was really sick.
Exactly.
And they're more likely to make lifestyle choices after that.
Well, that's kind of led me to having this conversation with you.
Absolutely, yeah.
So, and kind of doing this jury stuff. So I've seen you've published a lot of medical papers. So I was going to ask if you can share any current evidence-based research on improving the life of patients with vascular diseases. And one in particular that I saw was one you had from June 2020, which was the same situation as my case, that mortality was decreased with the adoption of a multidisciplinary PE response to teams. So you basically, when I was in the ICU, you were part of a team that was kind of discussing my situation, what to do, etc. So
absolutely. So at Cleveland Clinic, we have something called a PERT team. So that's Pulmonary Embolism Response Team. And this is a newish concept, probably over the last 10 years. It's evolving, and we see it more and more around the country. We have a very large PERT team at Cleveland Clinic. In fact, we're one of the first hospitals to have it at several of our branches as well, to deliver this emergency care. So I was on call last week, and we had a lot of these emergency meetings, day or night, where we discussed patients. And the thought process behind these PERT teams is it's better to have several doctors discuss a patient's case and expedite care, as opposed to just having one doctor. One doctor having to call another doctor, who calls another doctor, who calls another doctor. And so what we do is we have these activations, or these emergency activations, and we have several doctors join a phone call, and we discuss what's best for that particular patient at that particular time, and we come up with a plan of how to enact that in that hospitalization.
I guess your study showed that there's a decrease in mortality by taking that approach.
So patients that have had a PERT activation, when we compare these patients pre-PERT era to PERT era, we see a decrease in mortality in the PERT era.
Again, why the Cleveland Clinic's #1 in the U.S. for heart. I mean, and you also just got ranked #2 globally for hospital care.
Which is our 30th year being ranked #1 in cardiac care.
Yeah, outstanding. Okay, so I want to ask a question, what's next for you? So one of the interesting things when I was looking up, you're talking about using AI for medicine. I guess I'm curious, well, A, what's next, but B, kind of what I keep hearing AI. I interviewed a farmer who was talking about using AI. It's like, really, farming and AI? So it's just curious what your thoughts are around that.
So, I think there's a number of uses of AI within healthcare, particularly within the world of PE, or blood clots of the lungs. One that we're currently submitting for publication is, how can AI help patients understand what's going on with them? And so we've done a series of questions that we asked to doctors regarding blood clots, so to get an expert answer. And we posed those same questions to AI chatbots, and we looked for the accuracy between the two. And we found that it's almost 99% accurate. So these chatbots are extremely accurate in terms of answering patient questions. And so, patients may have questions for their doctor that they forget to ask during the visit, or they maybe feel uncomfortable asking. And so how can we incorporate AI into answering patient questions and doing it accurately? So is that, a physician reads over it, or a nurse reads over the response before it's sent out? Or do we train these chatbots on very common questions and have those chatbots available to patients 24/7, able to answer questions? I don't think AI will ever replace a doctor, but it certainly can augment being a doctor.
Interesting. So that chatbot is a Cleveland Clinic specific.
These are the ones we did our research on. Were not Cleveland Clinic specific chatbots. These were just Google or ChatGPT AI bots.
Wow, and 99%.
Very accurate. Wow. Very accurate. And the other thing that we see now increasingly is that AI can read images. So AI can read CT scans and do it instantaneously. And so as opposed to having a long queue for a radiologist to read of CT scans, AI can quickly look at all those CT scans, find the pertinent ones that have large blood clots, bring those to the top of the queue. And in some places, different hospitals around the country, AI can actually activate that emergency response team. And so as soon as that CT scan is done, AI can activate that response team and, get rid of the radiologist interpretation within the middle, or maybe expedite it and have that response team activation done quickly.
Nice to kind of speed things up. So what's next for you? What's your ambition here? Are you going to keep doing pulmonary embolism?
Yeah, and I think this is my passion. So it's truly my passion, and it's something I really enjoy. And so Cleveland Clinic's been supportive of my research, so ongoing research efforts, applying for more grants, and really continuing the work that we've started within this. Our big focus really now is we're getting better at treating PE, but what are the long-term outcomes of PE? And the big things that we look at are the emotional ones. So we look at anxiety, depression, quality of life. Doctors are very, very good at helping patients survive.
Yes.
We're very, very bad at truly sometimes improving their quality of life. What we found is about 20 to 30% of patients, after having a blood clot of the lungs, will have anxiety or depression. And sometimes that anxiety and depression goes unanswered. Patients never ask about it, they never state anything, and that can decrease people's quality of life. Sure, I got you out of the hospital, I helped you survive your blood clot, but if you have 20 to 30% of patients are having anxiety or depression, then our job is incomplete.
Right.
And so a lot of the research we do now is trying to identify that. At Cleveland Clinic, we have questionnaires now. So we're doing a lot of questionnaires when patients come in just for a follow-up visit. Even though it's completely unrelated, we'll still check to see if they have anxiety or depression. And it's something we can quickly talk about. And the catharsis, or the relief, emotional relief we see out of patients, it's huge. It makes it very rewarding.
Interesting. So it's kind of, because I don't think a lot of people would associate that symptom with what had just happened to them. Probably just figure, well, it's not understand the relationship, I guess.
Absolutely.
Is kind of my point.
And again, it just gets back to education. Right?
Yeah.
How can we normalize it? How do we tell patients it's not unexpected to have anxiety or depression after having a blood clot? It can be a life-changing event for people, and it's very normalized with other disease processes, but with PE, it gets back to that just lack of education, maybe a lack of research even, and so we're trying our best to shine light on that.
Yeah, I think it's important. I mean, until we had met, I didn't realize it was a number 3 cause. I mean, that's just, I will not forget that conversation.
Yeah.
So I know you like to travel. We were kind of talking about that before we started here. So do any of your travels change the way you look at medicine? I know you mentioned kind of the food aspect. People go overseas, they feel healthier. When they come back, they don't feel as healthy. Any observations from your travels, I guess?
I think the big thing that I've observed in my travels is Americans are stressed. Very simply, Americans are very stressed. And we were just in Greece, And before that, we were in Romania. So my wife is Romanian, and so we were in Romania. And you see the stress levels are just lower. People are a little bit more carefree and enjoy life, and they view work as a means to live life. And in America, our life is our work.
Yeah.
And that leads to a lot of stress. And what we're seeing now is that stress in of itself is pro-inflammatory. And it kind of gets back to what we were talking about. Pro-inflammatory diets, we know those can cause blood clots or have links to blood clot. And so is stress a risk factor for blood clots? We're seeing that more and more it is. And so I think my big takeaway from traveling internationally is to relax.
Chill a little bit.
Yeah, just chill just a little bit more than we normally do. But I think in America, it really is an epidemic of stress.
Boy, that's a whole other conversation. But I guess explain the inflammation piece, because I've been reading more and more about inflammation. I just had a test done, and I had been taking this supplement that's supposed to kind of help with longevity. I'll just kind of leave it at that. And so I had a blood test done, and it's supposed to help your mitochondria, basically. And I had a blood test done, and it came back and said your mitochondria is not healthy. And then they did another test for mold and found out I had a mold issue that they're now, the clinic is now solving for. So that's creating inflammation. So I guess explain the impact of inflammation, I guess, on kind of what we're talking about here. I didn't understand it, quite honestly, but I mean, I get what a blood clot is, and now that you've described that, but just inflammation in general, why that's important to understand.
Yeah, so within our blood vessels, we have what we call an endothelial lining. So that's the lining of the blood vessels. And whenever we have pro-inflammatory things within our body, it activates that endothelium. And so an activated endothelium secretes things into our blood that are what we call prothrombotic. So factors or different things within our body that make you more likely to develop a blood clot from that activated endothelium, which comes from inflammatory markers. And so it's kind of a little bit of a cycle.
Okay.
The more inflammatory conditions you get in your body, whether that be autoimmune conditions, whether that be Crohn's or GI things that cause inflammation within the body, those things have a direct access to your blood. And your blood has access to your endothelium. And then your endothelium releases these pro-inflammatory markers. And so it's kind of a vicious cycle.
Interesting. And that's part of food, exercise, I'll say meditation, just kind of stress relief. If you're living in the United States, you should be thinking about all those things to kind of prevent that inflammation.
Yeah, and I think as time goes on, we're going to see stress relief has more and more of an impact on our bodies.
Yeah. Couldn't agree more with that. So what would you say in your career so far, what's been your proudest accomplishment so far?
Doing things like this, connecting with patients on things that impact them, helping patients see the importance of what we do every day, to me is extremely rewarding. You've kind of taken these steps after having what happened to you, and now you're educating people. This is something that's extremely rewarding to kind of give back and help educate people on something that's really passionate to me.
Nice. And I thank you for being here. Any final thoughts you want to leave the listeners with?
I think it all starts with one step. Taking that first step to a healthy lifestyle, whether that be a small step of exercise, whether it be a bigger step of changing your lifestyle in terms of how you eat, these small first steps can really lead the wheel in terms of getting us moving. And so just take that first step.
Fantastic. Did you bring a recipe to talk about?
I don't have a specific recipe, but I can tell you something that my wife and I now love to do.
Okay, sure.
It's when we eat healthy, you were just talking about this. Having a piece of salmon and maybe not adding 10 things on top of it kind of ruins the nutritional thing. Our new big thing has been Greek yogurt.
Okay.
And so we make a lot of yogurt sauces, which are just really easy to make. Our favorite one is probably a honey sriracha yogurt sauce. So it's just, a cup of Greek yogurt, a tablespoon of sriracha, tablespoon of lime, or a teaspoon of lime, and a teaspoon of honey. You mix it together and you get a great dipping sauce.
Okay.
So instead of these, additives and preservatives and all these different things that come with over-the-counter dipping sauces or a sauce that you may marinate something in, Greek yogurt it's a big hack, a big healthy hack.
So you could do that with chicken, you could do that with pretty much anything. Yeah.
Anything.
Fish,
it's great.
Beef,
you can dip it, you can marinate it in. It's what we love to do now. Yeah.
Nice. All right. Well, I'll create a recipe from that. We'll get that posted.
Yeah.
Because that is, and I agree that that's simple. That's, and one of the other things we talk about a lot is too, when you're buying whatever you're buying in the grocery store, make sure you look at the ingredients and make sure you understand. And if you can't understand the ingredients, then just put it back or make it yourself at home. I mean, salad dressing's easy. You're talking about a dipping sauce or marinade, that's easy. And we're talking about 5 minutes. I mean, it's not hard to mix 3 or 4 ingredients together.
Honey sriracha yogurt sauce.
Yeah.
Very easy, clean, healthy.
Yeah, and I mean, you can cook at home, you can do it quick, you can make it easy, you can make it inexpensive. I mean, it's not... 4
items, and that's it.
Yeah. All right. So I started to add this little segment, at the end of the show here. So in the spirit of trying to get people to eat simpler and healthier, so fruits and vegetables in the Midwest, probably all over the country, are very in season right now. So what I'm doing is posting on the podcast on my website links to basically a website that you can go in and say, I'm in the state of Ohio, the month is July, and it will tell you what's in season. Yeah. So that when you go to the grocery store or go to a farmer's market, you can, it's going to taste better because it's fresh. So currently in the Midwest, there are literally over 60 in-season ingredients that you can buy that are fresh. Go to a farmer's market, go to a grocery store that works with farmers, or wherever you shop. But basically things like arugula, basil, cabbage, blueberries, blackberries, carrots, cucumbers, lettuces, garlic, onion, and peppers. So that's, I don't know, a little over half a dozen things. So those are all things you can just readily get. They're going to taste better this time of year because they're fresh from your, wherever you do your own shopping. And that's why we got to fix kind of this whole food desert thing, because they don't have access probably to any of that stuff, unfortunately. So that's something we got to solve for. So,
very noble mission.
Yeah, thank you. So, thank you again for being a guest on the show. Much appreciated.
Thank you for having me.
Tell our listeners if they want to find you somewhere, they just go to clevelandclinic.org. Is that kind of
you can just Google my name, LebenTefera, and I think one of the first things that pops up is my Cleveland Clinic profile with the office number there, and they can always reach out.
Fantastic. All right. Thank you very much for being on the show.
Absolutely. Thank you for having me.
All right. Thanks, Dr. Tefera. All right.